Hello, I'm Sammy and I'm going to just walk you through this course on, this presentation actually that fits into a wider course. So this presentation is actually about conduct disorder, and although this is for a course in the early years and conduct disorder would not usually present in the early years, those working in early childhood education, looking at psychiatric and mental health disorders, would want an overview really of what conduct disorder is, although it's more likely to present later on. So as I said, I'm Sammy Fugler from London Bridge College, and let's dive in. It's a short presentation. We just have 12 slides that just really give us a flavour of what conduct disorder is, what it looks like and how it can manifest. Okay, so let's start off thinking about what is conduct disorder. Conduct disorder is actually a serious behavioural and emotional disorder that can occur in children and more frequently in teens. A child with this disorder may display patterns of disruptive and violent behaviour and also have significant problems following rules. Okay, so types of conduct disorder. Conduct disorder is categorized according to the age in which the symptoms first start to present, when it first starts to occur. So childhood onset occurs when the signs of conduct disorders appear before the age of 10. Unspecified onset means the age at which the disorder first presented is unknown, and obviously adolescent onset is where the signs or indicators would appear during those teen years. So what are the symptoms of conduct disorder? I hear you cry. Well, we have a few slides on this, so I'll walk you through them. The first thing that we're looking at is aggressive conduct, and that might be intimidating or bullying others, physically harming people or animals on purpose, committing serious sexual misconduct such as rape, using a weapon, for example. And moving on, deceitful behaviour, which could include lying, breaking and entering, stealing, forgery. Destructive behaviour, which could include arson, for example, burning building or property, and the intentional destruction of property. Okay. Another symptom that we'll be looking at is violation of rules. This might include, for example, skipping school, running away from home, drug or alcohol use, and promiscuous or sexual behaviour at a very young age. So those are some of the symptoms or indicators, as I would like to say, of conduct disorder, and those are some of the ways that you might be able to recognize it. We're going to go on now, just in our very short presentation, to think about what the causes might be. So genetic factors, obviously, and organic factors, biochemical factors, and psychological factors as well. Child abuse, dysfunctional family background, parents who abuse drug or alcohol, parental rejection, severe poverty or disadvantage could also be triggers. So what does the research say about who is at risk? So the at-risk groups are male. Being male is predominantly more risky for conduct disorder than being female. Living in an urban environment, in significant poverty, for example, having a family history of conduct disorder or mental illness, having a psychiatric disorder, using or abusing drugs and alcohol, a dysfunctional home environment, having a history of experiencing traumatic events, or being abused or neglected, especially in childhood. Okay, so when it comes to diagnosis, what the clinicians are looking at is taking a complete history, looking at educational history to determine cognitive deficit, learning disabilities, or problems, for example, in terms of intellectual functioning, and also a neurological examination. So these three factors together would support a clinician's diagnosis. And treatment, what might treatment include? Well, it could include drugs, it could include psychotherapy, counselling, and guidance and social skills training, which might be role play training, modelling, or other therapies that support the shaping of behaviour. And also nursing management, where several highly trained staff provide close supervision on an ongoing basis for the child, observe the child for anger cues, encouraging activities and aggressive behaviour, and also set limits on manipulative behaviour and identify consequences of manipulative behaviour. So that is just a quick light dive into just starting to understand what conduct disorder might look like.